everyone, and thank you so much for taking time out of your day to join us for the NeedyMeds special topic webinar, The Financial Impact of Cancer. My name is Carla. I am the Director of Education at NeedyMeds, and before we jump into today's presentation, I want to go over just a few pointers. You can feel free to type any questions you may have into the questions section of your GoToWebinar control panel. Just know that we will reserve answering questions until the end. If we don't have the time to answer your specific question, we will follow up with you personally via email by tomorrow afternoon. Of course, we will provide the contact information for both NeedyMeds and Triage Cancer, and we encourage you to reach out with any questions. So with that, let's get started. One of the things I also want to make sure is that all of our audience members are familiar with NeedyMeds. What you're looking at is our updated mission statement. NeedyMeds' goal is to connect people free and anonymously through our website and helpline to programs that will help them afford their healthcare expenses. And as you can see, a big part of our mission is educating people. And we do that by letting them know certainly about NeedyMeds and the resources we have to offer, but also by letting them know about other resources available for specific diagnoses, which is why we are so pleased to have our guest here with us today from Triage Cancer. Before I move on to that, I just want to give you a snapshot of the NeedyMeds homepage. And one of the things I will remind you at the end is that today's webinar is being recorded, and again, it will be converted so you can view it at a later time or share it with people. And that will be posted on our YouTube channel. And that icon can be found in the top right hand of the NeedyMeds homepage. So getting back to today's presentation, as I said, we have a guest here with us from Triage Cancer. Triage Cancer is a national nonprofit that provides education on the practical and legal issues that may impact individuals diagnosed with cancer and their caregivers. And it's my pleasure to introduce our panelist, Monica Bryant, Esquire. Monica is a cancer rights attorney, speaker, and author dedicated to improving access to quality information on cancer survivorship issues. She is co-founder and chief operating officer for Triage Cancer. Throughout her career, she has provided hundreds of educational seminars, written articles and blogs, appeared on community television and radio shows, and authored a book on cancer rights law. And suffice it to say, that is an extremely abbreviated resume or bio on a presenter who we are so thrilled to have with us today sharing her expertise on this topic. So without further ado, I'm going to go ahead and hopefully seamlessly pass the mic and the screen to Monica, so bear with me while I do that. And again, while Monica takes over that screen, I will remind you, if you have any questions, you can feel free throughout the webinar to, again, type them into the questions section of your GoToWebinar control panel. Thank you so much and enjoy today's presentation. Monica, you can take it away.
Thank you so much, Carla. I'm absolutely delighted to be here today talking about an issue that I think is so incredibly important to be discussing. And we're so honored to have this partnership with NeedyMeds. We really do believe collaboration is the key. So, financial impact of cancer is obviously a huge topic, and we can only cover so much in an hour. So throughout the presentation, I may be pointing you back to various resources that Triage Cancer has on our websites and events that we hold. And I spend a few minutes at the top of the presentation talking about the organization, not to be a commercial, but to rather give you the peace of mind that this hour we're together is not the only time that you can access this information. So for those of you who aren't aware, Triage Cancer is a national nonprofit organization that provides education on the legal and practical issues that may impact individuals diagnosed with cancer and their caregivers. We participate in events all over the country, many like this, that are hosted by our partners in the community, and some are events that we host ourselves. So to see where we're going to be, you can take a look at our events calendar. And we may actually be in a town near you. So every year we host the Triage Cancer conferences. These are day-long events that cover a variety of cancer survivorship topics. We welcome patients, survivors, caregivers, advocates, and healthcare professionals. It's a free event. We also offer travel assistance to patients and survivors to attend these events. and CEUs to healthcare professionals. Now, I should have said at the beginning, Triage Cancer is primarily a cancer organization. However, much of what we discuss is not really cancer specific. These laws and the theories that we talk about are really applicable to anyone dealing with a serious illness. So we really welcome anyone to come to these events who may benefit from them. Much like NeedyMeds, we host a monthly webinar series and they're open to anyone in the community. We also host recordings of past webinars on our website as well. Now, if there's any healthcare professionals on the call today, we do host 2 events that are specific to you. The first is an in-service titled Navigating Cancer, Work and Insurance. And the second training for healthcare professionals is the Insurance and Finance Intensive. And during this day, we really get into the weeds on all things health insurance and finances. You can get more information and register for any of the events that I've just talked about on the triagecancer.org website under the Events tab. Now, in addition to our events, we offer a number of educational materials and resources online. Our quick guides are designed to be a snapshot of a particular topic, and they cover areas like health insurance, employment, clinical trials, financial topics, estate planning. We also have checklists and other documents just designed to help with the legal and practical pieces of survivorship. All of these documents can be downloaded for free on our website, or you can order hard copies of these materials on our website. And because we recognize that everyone learns in different ways, we also provide educational animated videos on these topics. This one is on health insurance basics, and it gives you key information, some of which we'll talk about today. These videos are available in English and Spanish versions, and on the English video, it also has subtitles in Tagalog. I will be talking about different entities that are responsible for overseeing different laws, and we've compiled that information for you by state. And because where you live can impact what protections you have access to, we have created charts of state laws on employment, disability, health insurance, and other cancer-related legal issues. Now, we would travel around the country and hear from people, oh, I wish I could just put you in my pocket so that you'd be around to answer the questions when I had them. And unfortunately, we cannot be in everybody's pocket. But we sort of figured out the next best thing was to create a website that would provide practical and legal information to individuals and have them answer specific questions. And based on the answers to those questions, the site would guide them to the most relevant information to their situation. We currently have modules on health insurance, disability insurance, education, and financial assistance, and we're adding more modules on a regular basis. Our educational blog not only provides information about cancer survivorship topics, but because things are constantly changing, this is how we share late-breaking news. And our monthly e-newsletter is how we share our upcoming events. Now, everything I've talked about up until now is totally free to access, and we welcome everybody. However, throughout the years, we heard that people were interested in having one comprehensive resource that explained all of the laws and protections that we talk about. So we recently wrote a book published by the American Bar Association on cancer rights law. If you go to this website and type in Triage Cancer in the discount box, you can get a 35% discount. So with that, I'm going to move on to the substance of today. But again, I really hope that you recognize that today is just the start of the relationship and that we do offer this information in many different formats. So if you have ever tried to put together one of those giant jigsaw puzzles at some point, you could imagine that it would be even more challenging to complete if you never saw the picture of what the final product was supposed to look like. And that's how it can feel to a lot of people who are navigating the complex maze of cancer. They're diagnosed and they find out along the way that there are so many things that they need to think about and deal with, but they don't always have that view of the overall big picture. So throughout the various programs we provide, we try to give individuals the different pieces so that they can put together their own unique puzzle. And just some of the pieces of that whole picture include the specifics of employer policies, federal and state laws, employment contracts, how finances come into play, other types of health insurance or insurance. And all of these pieces are vital because it's in cases where people don't know what the law is that they ultimately fall through the cracks. In 2013, researchers from Duke University coined the term financial toxicity. And in their research, they focused on the financial burden of a cancer diagnosis and how significant that burden can be, not only in an acute way at that moment, but also in that long-term impact of financial burden. And this isn't just about somebody's bank account. There is extensive data now to show how the financial burden is causing stress, depression, anxiety, quality of life. So while this is a new term, relatively speaking, it's certainly not a new problem. But there's no easy solution to the problem of financial toxicity because there are multiple contributing factors. And all, or most, of the factors need to be addressed to effectively mitigate the financial toxicity. And the primary culprit of financial toxicity is having inadequate health insurance, which we'll discuss at length today. Also, potential employment changes and life changes can also impact somebody's financial health, and effectively navigating these changes is often rooted in having a good understanding of the law. Now, if you don't understand health insurance, you are certainly not alone. I would say there is a general lack of understanding around health insurance in this country because it is so complicated. One survey conducted on employees' understanding of their plans and how they actually worked were quite striking. 50% of the individuals who were surveyed didn't even know what they were paying monthly towards those policies, and less than a quarter even understood the terms that were being used. So it stands to reason that if people don't understand their policies, they're likely not navigating them effectively. Something as quote unquote basic as having an understanding of the terms used in health insurance policies can make a significant impact. So before I jump into the specifics of health insurance, I really just want to make sure that we're all on the same page with respect to some terminology. And these are terms that are so often used but frequently misunderstood. When we talk about a premium, we're talking about the amount that you're going to pay monthly just to have health insurance. And you're going to pay this whether you go to the doctor or not. Then there are costs that you're going to incur when you actually use your health insurance. The first is your deductible, and that's the amount that you have to pay out of pocket before your health insurance company will cover their share of the costs for your medical care. And their share of the cost is referred to co-insurance, otherwise known as cost share. Your portion of the cost share is the amount that you're responsible for paying after the insurance company pays their portion. So if you have a plan that has a 20% co-insurance amount, it means your insurance company is going to pay 80% of the costs of your care, and you pay 20% of the costs once you've met that deductible. Now, a co-payment is the amount that you're going to pay when you get care. And this is going to be very dependent and specific to your policy. So for example, many policies have a $25 copayment when you go to the doctor's office, or a $35 copayment to see specialists. When we talk about your out-of-pocket maximum, we're talking about your deductible plus your copayments plus your coinsurance. So it's everything you're paying out of pocket except that monthly premium. Now, like with everything else, the devil's in the details here. Typically, health insurance policies will only count payments made towards in-network services towards your out-of-pocket maximum. Additionally, we're seeing some policies carve out the deductible from the out-of-pocket maximum. So it's really critical to look at your specific policy and to see how they're handling it, but I want to just walk you through a pretty simplistic example of how this all could work. So David has a health insurance policy with a $2,000 deductible, an 80/20 coinsurance, and an out-of-pocket maximum of $4,000. David gets injured, goes to the hospital, and ends up with a $102,000 hospital bill, what does he actually pay? Well, the first thing that he pays is going to be the $2,000 deductible, which leaves $100,000 left of his bill. His coinsurance amount is 20%. 20% of $100,000 is $20,000. But thankfully, David has a plan with an out-of-pocket maximum of $4,000. So he would only have to pay the $2,000 deductible plus another $2,000 of that coinsurance amount for a total of $4,000 out of pocket. Again, a very simplistic example, but just an attempt to kind of lay out how this all works. Now, a few other terms that I want to make sure we all understand. In-network versus out-of-network. Most health insurance policies have a network of providers they've contracted with to provide services for a set rate. If you go to providers within that network, you're going to be charged that contracted rate. However, if you go to providers out of that network, your insurance policy probably won't cover those services at as high of a rate, and they may not cover them at all. We started to see something referred to now as surprised billing. A surprise bill is when someone goes to an in-network facility, but then somewhere along the line sees an out-of-network provider, and then receives a bill for those services. For example, let's say you go to a hospital that's in your network, the surgeon's in the network, you think everything is fine, but then you get a huge bill from the anesthesiologist who happened to be out of network, and you didn't know that. This was happening quite frequently and really sort of hitting consumers hard. So several states have stepped in and passed laws to protect consumers and to limit the ability of providers to saddle consumers with a surprise bill. But of course, that is a state-by-state protection. Now, this is very different from the concept of balanced billing. And unfortunately, in a lot of news outlets, we've been seeing the terms used interchangeably, and they're not the same thing. Unlike surprise billing, balanced billing is where the patients are charged the difference between what the provider charges and the insurance company pays for a service. If the provider is a preferred provider, they're not allowed to balance bill. So for example, a provider charges $100 for the service. The allowed contracted amount with the insurance company is $70. The provider has to take that $70 as full payment. They can't turn around and then charge the payment the extra $30. Now, in this country, there are a couple main types of health insurance policies. Many of these policies look similar, but there's some key important details. The first is a health maintenance organization, or an HMO. With an HMO, you pick one primary care physician, and they are the gatekeeper of your healthcare. So all the services go through that physician, which means that you typically need a referral before you can go see any other healthcare professionals, except in an emergency. Let's say you get a skin rash, you don't go straight to the dermatologist. First, you start at your primary care physician, they examine you. If they can't help you, then you get a referral to a dermatologist. Coordinating all of your care through that primary care physician means less paperwork and typically a lower cost. HMOs also generally have a smaller network of providers. Compared with a preferred provider organization, or a PPO, which gives you a little bit more flexibility. You don't need a primary care physician. You can go to any professional without a referral, in or outside of your network. Staying inside your network means smaller copays and more coverage, but again, you can still go outside of your network if you want to. PPOs generally also have a much larger network of providers. The trade-off, though, is that PPOs are typically going to be more expensive than HMOs. So there's a trade-off in that for more choice, higher cost, lower cost, less choice. Now, an EPO, or an exclusive provider organization, is a hybrid of the two. It's very similar to a PPO in that individuals have a network of doctors that they can choose from. However, unlike with most PPOs, EPOs will not pay for services outside of the network. So again, when we're purchasing insurance, we may have choices between HMOs and PPOs and EPOs, and there's really no one size fits all. I often get asked in these presentations, well, which is better? And it 100% depends on your needs and where you are. There are some cities we go into that have wonderful HMOs that provide everything a consumer could need. There's other places that just don't have that, so a PPO is probably going to be a better option for them. So definitely not a one size fits all. Now, we talked a little bit about employment changes contributing to financial toxicity. And one of the reasons that that occurred is because many of us get our health insurance from our employers. So what happens in the situation where an individual has to stop working due to a cancer diagnosis and treatment? What do they do for their health insurance? There is a federal law called the Consolidated Omnibus Budget Reconciliation Act, better known as COBRA. And COBRA allows eligible individuals to keep their existing employer-sponsored health insurance after they experience a qualifying event that makes them lose their coverage. What is wonderful about COBRA is that it is the exact same health insurance policy. So someone who is in the midst of treatment does not have to try to find a new policy that meets all of their needs. One of the main barriers to COBRA is cost. Typically, once you elect COBRA, you have to pay 100% of what your employer was paying for your coverage, plus a possible 2% administrative fee. And most of us don't appreciate how much our employers are paying for our health insurance until we have to write that check ourselves. COBRA applies to private employers with 20 or more employees or state or federal governments. Now, the length of time that you can keep your COBRA coverage is going to depend on your qualifying event. If your qualifying event is that you have to stop working or that you've reduced your hours and maybe gone to part-time, and your employer only provides benefits for full-time employees, you're going to be able to generally have COBRA for 18 months. Let's say instead you're losing your coverage because you're aging out of your parents' policy, then you'd be eligible for COBRA for up to 36 months. Now, I mentioned that COBRA is only available to individuals who work with employers with 20 or more employees, but thankfully, many states have stepped in and passed state COBRA laws. And these laws vary greatly, but they're going to cover employers with 2 to 19 employees. And the details really vary state by state. So if you're interested in the rules in your state, you can definitely check out that chart of state laws on triagecancer.org. Now, since the passage of the Affordable Care Act, we hear from a lot of people, I don't really understand. Why would I elect COBRA when it's so expensive? Why wouldn't I just buy a new policy? Well, there's some pros and cons to COBRA. It could be that your employer coverage is very, very good, whereas the coverage that you could buy in the open market is not as good. The other thing that we want people to take into consideration is if they have reached a point in the year where maybe they've already met their deductible and their out-of-pocket maximum. It may actually be more financially savvy to pay those high monthly premiums in COBRA and know that that's all you're going to pay for the rest of the year, rather than purchasing a new plan and having to start over paying towards your deductible and your out-of-pocket maximum. So again, you're going to have to do the math, and we'll show you how to do that in a few minutes. Now, I wanted to briefly mention Medicare as a health insurance option, but I will preface this with saying I could spend somewhere between 8 to 10 hours with you just talking about Medicare. So this is going to be a very high-level overview. Medicare is one of the 2 main government health insurance programs, and it's open to individuals who are US citizens or legal residents that are over the age of 65, or that have been receiving Social Security disability insurance payments for over 2 years, or they have end-stage renal disease, or ALS. So it's relatively limited in terms of eligibility. Medicare is incredibly complicated, but I will say that the government website, Medicare.gov, is very well organized. And the basics of Medicare are that there are four main parts. Part A is your hospital insurance. So it's typically going to be inpatient services. For individuals who have worked in this country and paid into the system, most people won't have to pay a monthly premium for Part A. However, there is a deductible to pay. Part B is our medical insurance. So that's going to be doctor's visits, immunizations, tests, screenings, example. Even if someone has worked and paid into the system throughout their life, there's still a monthly premium for Part B. Generally speaking, in 2018, the monthly premium is $134. There's also an annual deductible to Part B. Now, when we talk about Part A and Part B together, they're often referred to as original Medicare. But as you may have noticed, I have said nothing about prescription drugs yet. So that is where Part D comes into play. There is an annual deductible for Part D plans, and there's a premium for Part D plans. So it turned out that for some people, keeping track of potentially 3 different premiums, 3 different deductibles, 3 different plans was too complicated. So an alternative was created in Part C, also known as Medicare Advantage plans. And these Advantage plans operate a little bit more like we're used to in traditional insurance. They're sold by insurance companies, Blue Cross Blue Shield, Humana, Aetna. And they offer your Part A and Part B services bundled into one. They may also provide prescription drugs included in there. There's, again, pros and cons to all of this, but the way that Medicare works is that you have to pick a side. You're either going to go down this left-hand side where you pick Part A, Part B, and Part D, or you go down the right-hand side where you pick Part C. Now, again, I mentioned that is the quickest overview of Medicare that could possibly exist. But next month, we will be providing a free webinar where we'll spend an entire hour talking about Medicare and get into the weeds a little bit more. And we're providing free CEs for nurses and social workers. So I hope you will join us for that. All you have to do is register on our website. Now, in an attempt to address the inadequacies of insurance plans, consumer rights, and increase options for individuals with a pre-existing condition, Congress passed the Patient Protection and Affordable Care Act in 2010. This is also referred to as the ACA, the Affordable Care Act, Obamacare. It's all in fact the same thing, but there is still, 8 years later, a huge amount of confusion about that. The ACA is a huge piece of legislation, but I just want to narrow in on 2 main buckets of it today, which are the consumer protections and the new options it provided. When looked at these new consumer protections and benefits collectively, they're really designed to make insurance more adequate. For example, insurance companies have to cover the routine costs of participating in clinical trials. Most plans have to cover preventative services for free. They can't place dollar limits on the amount that they're going to pay out for somebody's healthcare costs. And these benefits here don't just impact people who purchase their own insurance or people with lower incomes. They're going to impact almost all of us as consumers. But having access to adequate health insurance is only half the battle. The reality is that many cancer patients will face a claim denial at one point or another. And it's critical for all of us to understand that we don't necessarily have to take no for an answer. Insurance companies have an internal appeals process. The details are going to vary based on the company. So you should check with your specific policy and contact the insurance company for more information about their process. But thanks to the Affordable Care Act, all states are now also required to have an external appeals process, which is sometimes referred to as an independent medical review, or IMR. The details vary state by state, but for more information, you should contact your state's insurance agency. And again, we've compiled that contact information on the state resources page of our website. The chances of getting your appeal approved increase, or I'm sorry, the chances of you getting your claim approved definitely increase if you appeal. One study in 2011 showed that somewhere between 39 to about 59% of appeals were decided in favor of the patient. So it's really in your best interest to think about appealing if you've received a claim denial. And in fact, there's some areas where we're seeing that insurance companies are making future coverage decisions based on the frequency of appeals. So for example, in California, there's a lot of individuals who are appealing denials for fertility preservation coverage. And because of that, we're seeing some insurance companies think about starting to offer that as a covered benefit. Now, if the Affordable Care Act did nothing else but what I'm about to talk about, I would still say it's a win for the cancer community. And what the ACA did was it limited what insurance companies could look at when they're deciding what they're going to charge someone for their monthly premium. This is also called premium rating. So after January 1st of 2014, insurance companies are only allowed to look at 4 things. Are you buying an individual plan or a family plan? Your geographic location based on zip code, your age, so the older you get, you can be charged more, but there's now a limit on how much more you can be charged, and your tobacco use. In most states, if you use tobacco, you can get charged more. So this is pretty significant in that insurance companies can no longer look at somebody's health status to decide what they're going to charge them, and they can't take gender into account anymore. Prior to the ACA, women were charged a higher rate than men for the same policies. Now, the other thing that the Affordable Care Act did was it said that insurance companies are no longer allowed to deny selling somebody a policy based on their pre-existing condition. They also can't exclude covering services related to a pre-existing condition. This is absolutely game-changing for anyone with a serious illness. Now, last year, you may remember that there were many efforts to repeal the Affordable Care Act. And during the last election, we also heard many elected officials say that they want to keep this pre-existing condition protection. They wouldn't get rid of that. That's great. Even though we don't like anything else about the law, that we want to keep. The problem was what they were referring to was just number 2 here. And the concern is that if we just keep number 2, not coupled with number 1, someone may have the legal right to purchase a policy, but it may be priced so high out of their price range that it's an impossible thing for them to do. So from our perspective, in terms of protecting individuals with pre-existing conditions, these 2 provisions have to be kept together. Now, as an attempt to stabilize the health insurance marketplace and incentivize purchasing health insurance, the ACA instituted something called an individual mandate. That means that if someone chose not to have health insurance and didn't fall into the long list of exemptions, they would have to pay a fine. But in the most recent tax legislation that Congress passed, the penalty actually goes to 0 starting in 2019. We don't quite know what the impact this will have on the marketplace, but we do know there's a huge amount of confusion among consumers who don't think that they need to have insurance this year. And that's not the case because, as you can see, the penalty for 2018 is still $695. The other concern about this is that people have a misconception that if they pay the penalty, they'll be covered if something happens to them health-wise, and that's not in fact the case. So even if they pay a penalty, they will still, and they choose not to have insurance, they'll still have to pay for any sort of healthcare costs out of pocket. Some health insurance companies sell what's referred to as short-term plans. And these plans have a lower monthly premium and look very, very attractive. But We believe that individuals should be very wary of these plans. They're not required to provide the consumer protections included in the Affordable Care Act, and they're able to deny selling individuals and exclude treatments for pre-existing conditions. Additionally, many of them have high out-of-pocket costs for minimal coverage. So they look so attractive because it's that low monthly premium, but then if someone gets sick or needs to access healthcare, they're paying huge amounts out of pocket. These plans are also not considered to be what's called creditable coverage, since they're not required to renew coverage. This means that if your short-term plan ends in the middle of the year, it doesn't trigger a special enrollment period to buy in the marketplace, which typically leaves people uninsured, maybe in the midst of treatment. Now, these plans were supposed to be eliminated under the ACA eventually, but instead we're seeing them grow. Health and Human Services recently put out a rule that allows people to buy short-term plans for up to 364 days, whereas these plans were previously limited to 3 months. So again, they look very attractive, low monthly costs, they can last almost a year, but as you can see, so many of them don't cover very important healthcare services. So at Triage Cancer, we are always very careful to say that, people have to look at things for their own specific situations, and we very rarely blanketly say something is bad. But what we're seeing in the community is some real life or death situations around people who have purchased these short-term plans. So we're very wary of them. Now, moving on to the second government health insurance plan, which is Medicaid. Prior to January 1st of 2014, there were only 4 ways for someone to access Medicaid coverage. They had to have a low income and asset level and be able to walk through one of these 4 doors. For people who are coping with cancer, the way that they typically accessed Medicaid coverage was through the Age Blind Disabled program. However, many times people ran into a problem that even though they were coping with cancer and couldn't work, and therefore had a low income, they usually had too many assets, like a retirement account or a savings account, for them to be eligible for Medicaid. So they would have to spend down those assets to qualify, which would ultimately push them into financial ruin. One of the things that the ACA did was it created a 5th door for individuals to walk through. And these individuals have incomes at or below 138% of the federal poverty level. In dollar terms, that means people who are making just above $16,000 a year. And with this new option, there's no asset test. It's just about income. Now, when the ACA was written, the idea was that all the states would have this option. But the Supreme Court got their hands on the ACA, and in their decision, they essentially made this Medicaid expansion voluntary for states. So states had the option of just whether or not they were going to do it. And this is where we stand today. We have a situation where 32 states have expanded and 19 have not. But what's extremely unusual is that we're seeing situations where elected officials are ignoring voter-passed propositions and resisting implementation, and we're seeing that in Maine. And this is also still incredibly fluid. Earlier this summer, the Virginia legislature voted to join the 32 other states and expand Medicaid coverage, and that's supposed to take effect on January 1st of 2019. So this is a very fluid process, and frankly, this is the slide that changes most often in our presentation. Now, in addition to creating new access to Medicaid, ACA created something called a health insurance marketplace. When the law was passed, these were originally called exchanges, but no one knew what an exchange was, so they were renamed marketplaces. Turns out no one really understood what this meant either. The best way for me to explain these health insurance marketplaces is by comparing them to a shopping mall. The plans being sold in these marketplaces are plans being offered by private health insurance companies. Humana, Aetna, Cigna, Land of Lincoln. But the reason the marketplaces are important is that there's quality control and some benefits when purchasing through the marketplace. Plans, in order to sell in the marketplace, the plans have to meet certain standards. They cannot have an out-of-pocket maximum of more than $7,350 for an individual in 2018. You can see it goes up in 2019. And there's some financial assistance available for people to buy these plans. Another thing about the marketplace is that it was tried to simplify the shopping process for consumers by grouping plan options into categories based on the cost share amount. So bronze plans have a 60-40 cost share. Silver plans have a 70-30. Gold have an 80-20. And platinum have a 90-10 cost share. Typically, bronze plans will have the lowest monthly premium and the highest out-of-pocket costs. Platinum plans are going to have the highest monthly premiums, but generally speaking, the lowest out-of-pocket costs. So consumers can now shop for health insurance much like we shop for other consumer items like appliances or clothes. If I'm in a situation where I rarely see the doctor, I'm incredibly healthy, and all I want is minimal coverage should something happen, I can go to the marketplace and say, just show me the bronze plans. Or alternatively, if I'm a cancer survivor and I see the doctor every other day, I'm probably going to say, you know what, I would rather pay a higher monthly premium that is set and know that my health insurance policy is going to start picking up their share of the cost sooner. So only show me the gold and platinum plans. So again, it's very similar to how we shop for other things. I go to Amazon.com and I say I'm shopping for a black sweater. I can click black and I don't have to sort through the red sweaters and the yellow sweaters and the purple sweaters. I only see what I'm looking for. Now, with the financial assistance, there's two different types. The premium tax credit is going to reduce the amount that somebody pays monthly for their premium. The cost sharing subsidy, also known as a cost sharing reduction, is going to reduce the amount that you pay towards things like your deductible or your copayment. So let's say that you qualify for a $10 cost sharing reduction. You go to the doctor, you have a $25 copayment. But because you also have that cost sharing reduction of $10, that gets subtracted from what you owe to the doctor, and you only have to pay $15 out of pocket. Now, this financial assistance is all based on household size and income level. And this is how it shakes out in states that have expanded their Medicaid programs. For individuals who have incomes at or below 138% of the federal poverty level, they'll be eligible for Medicaid. For individuals between 138 and 250% of the federal poverty level, and they choose to buy a silver plan, they'll be eligible for a cost-saving reduction or subsidy. For people who have incomes between 138 and 400% of the federal poverty level, and they buy any level plan, they would be eligible for a premium tax credit. So there's some people that could get a premium tax credit and a cost-sharing subsidy. Now, if somebody was interested in purchasing insurance through the marketplace, they could start at healthcare.gov or their state website, because some states run their own websites. They could also call the hotline, send in a paper application, or there are some places where they can get in-person assistance. Now, when the law was written, there was a pretty big budget to train sister organizations on the marketplace and health insurance and provide funding to them to sit down with individuals and help walk them through choosing a plan in the marketplace. The funding has been cut substantially for the last 2 years, so it's unclear as to what many of these organizations are going to do. But if you go to this website at localhelp.healthcare.gov, you can type in your zip code and see the sister organizations that are near you. In terms of when you would enroll in insurance, Medicaid applications are accepted year-round, so whenever you become eligible, that's when you could submit an application. For individuals who are buying a policy through the marketplace, open enrollment is closed for 2018, and the 2019 open enrollment was just announced. It will run from November 1st to December 15th of 2018, and policies purchased in this open enrollment period will begin on January 1st of 2019. Now, this is a very truncated or shortened open enrollment period than we've seen in the past. Some states that run their own marketplaces have already said that they're extending their open enrollment period. So 2 examples are Washington, D.C.'s open enrollment will run through January 31st of 2019. California's will run from October 15th to January 15th. And we suspect there are some other states that will come out with extended open enrollment periods as well. Now, this is just for purchasing in the marketplace. For individuals who get insurance through their employer, open enrollment periods will vary. But if I had to overly generalize, I would say most employers, and again, I'm generalizing here, have their open enrollment period sometime in the fall. And open enrollment is when you can make any sort of changes or amendments to your health insurance policy based on what's available to you. But thankfully, with the Affordable Care Act, it recognized that things don't just happen during that open enrollment period. So if you are to have a life-changing event that means you're losing your health insurance coverage, it triggers something called a special enrollment period. And you then have 60 days to enroll in a marketplace plan. So this is outside of open enrollment. So what's fantastic about all of this is for an individual who might lose their employer-sponsored health insurance coverage, they actually have more options than they've ever had before. However, as we talked about earlier, the devil's in the details. If somebody is losing their employer-sponsored health insurance, they have to pick a lane. So the first option would be choosing COBRA or state COBRA, and we talked about why that might be valuable. The second lane would be buying a plan in the health insurance marketplace during a special enrollment period. The third lane might be going on another group plan that you're eligible for. So maybe you can go on your spouse's plan, or if you're under the age of 26, maybe you can go on your parents' plan. And then the fourth lane is potentially Medicaid or Medicare if you're eligible for either one of those. But the trick with all of this is once you experience that loss of employer-sponsored coverage, you have to pick one of these 4 lanes and stick in that lane. You cannot change lanes until the next open enrollment period. The only exception to that rule that you can't change lanes is if you're in a situation where, let's say you've decided lane 2, I want a marketplace plan, but based on the fact that when you've applied in the month, it's possible that your marketplace plan may not start for up to 30 days. So what you could do is you purchase the marketplace plan first, and then you go back and choose the COBRA coverage, making it very clear that you're only choosing COBRA coverage to fill that gap until your marketplace plan begins. And I know this is very detailed and in the weeds, but this is again somewhere where we've seen people really fall through the cracks in that they just elect COBRA and they realize 3 months in, oh my God, this is so expensive. Why didn't I look at my other options? And so we really want people to avoid doing that and making the best decision for them straight off the bat. So if somebody was ready to purchase insurance, they could start at healthcare.gov, and this is what it looks like. And as we talked about earlier, one of the most effective things that people can do to mitigate that financial toxicity is to have the right health insurance plan. But how do you pick one when you have more than one option to choose? Most of us have no idea how to pick health insurance. There's no class offered in high school about how to choose a health insurance policy. And I realize that some people may start to tune me out here thinking, well, I have insurance right now. I don't really need to pay attention to any of this, and I will start to see the number of attendees drop. But I urge you to listen to this because every one of us has the opportunity each year to assess our needs and make changes during that open enrollment period. And the analysis that I'm about to walk through right now is relevant even if somebody's comparing two marketplace plans, if they're comparing two plans offered by an employer. Maybe they're trying to compare if their employer plan is better or if a marketplace plan is better. Or maybe they're in a situation where they're trying to decide between two different Medicare plans. This analysis is relevant regardless of the situation you're in, anytime that you have more than one policy to choose from. I'm going to talk about the marketplace because it's the most universal, but just kind of try to extrapolate it to your situation. If somebody is shopping in the marketplace, there's some benefits now because there's some sorting options very similar to Amazon. You can sort it by the plan type, by the metal tier, as I was talking about earlier, by how much it's going to cost, and even by the company. Now, the only way to decide which plan is going to be the most affordable is to do the math. And here's how you do that math. Here's an example of someone who has 3 different options available to them. The top is a bronze plan with a monthly premium of $120. The second is a silver plan that has a monthly premium of $251. And the third is a gold plan with a monthly premium of almost $400. You can also see that there's some differences in the deductibles and the out-of-pocket maximums. So right off the bat, just looking at this, can you figure out which is going to be the most affordable? I certainly can't. I would assume that many of us would look to that bronze plan and say, okay, that's probably going to be the most affordable. And that's why you have to do the math. And the way that you do the math is by taking that monthly premium, multiplying it by 12 to get the annual amount, and adding it to the out-of-pocket maximum. And as you can see here in this example, the gold plan actually ends up being the most affordable. It doesn't always turn out this way. We do this all over the country and in different places. The bronze is the cheapest, sometimes it's the silver, but you don't know unless you actually do the math. But looking at the total cost is only the first step. Some plans may have a really high deductible, which means that you have to pay a lot of money up front before your plan starts to pay their share of the costs. So some plans have deductibles as high as $7,000. That's a lot of money to pay out of pocket before your plan starts picking up any of their share. Other plans may have a more expensive monthly premium, but have a very low deductible and a lower out-of-pocket maximum, which spreads the amount that you have to pay out of pocket throughout the year. Also, after you've looked at the cost of the plan, you need to see if your doctors and other healthcare providers are in the plan's network. As we talked about, many plans won't cover medical care that's out of network. And finally, are your prescription drugs covered and are at what rate? The marketplace also gives us some ability to find out this information before we purchase it, but it's always important to do your due diligence and double check the plan itself and your providers to make sure all the information is in fact relevant. Now, as I mentioned at the top of the hour, we have some animated videos that talk about a lot of this. We just released one on how to pick a health insurance policy. So if you're sitting there thinking, you know, wait a minute, I want to see that again, you can absolutely watch it in an animated version on our website at triagecancer.org. And please share it with anyone else that you think might benefit from it because we're only a few months out from open enrollment. Also, just want to highlight that health insurance is just one of the things that we talk about. We have a whole host of other issues. many of which go directly to the topic of financial toxicity and the financial impact of cancer. So please feel free to take a look at that. And I'm happy to take questions now. So I'll turn it back over to Carla.
Monica, thank you so much for that very thorough and really empowering presentation. I'm getting tons of feedback from our audience, and much like me, if you've been just newly introduced to Triage Cancer, you're blown away by not only the depth and scope of the information they provide, but what I think makes Triage Cancer, and in particular Monica's presentations, really valuable is that there is all of this complicated information that's broken down into chunk-sized bites that we can all really understand and benefit from. I do see tons of questions coming in, so thank you for that. A reminder, bear with me, everybody. Let me not as smooth as I had hoped with that transition, but hopefully you can see my screen now. And again, you can feel free to type any questions you may have into that question section of your GoToWebinar control panel. A heads up that we're not going to get the chance to answer everybody's question, but as I said, we will be happy to follow up with you via email within about a day. But of course, you can reach out to either NeedyMeds or Triage Cancer with any questions you may have. In the meantime, while I do have your attention, I want to remind everybody that NeedyMeds is here also to support you as you try and make the complicated decision about what health insurance plan is going to most benefit your family. And we hope that you can rely on NeedyMeds as a safety net to help you bridge the gap between the healthcare expenses you need and the ones that you can afford. What you're looking at on your screen, I'm just pulling up some of NeedyMeds' most popular and cost savings resources. If you're interested in learning more, please visit our website. If you have any questions, don't hesitate to call our expert call center counselors. I'll put that phone number up at the end of the presentation. Also, since I have your attention, I'm going to remind everybody that we do our best here at NeedyMeds to populate our calendar with special topic webinars as well as webinars so you can learn more about NeedyMeds. There's a snapshot of some of our other upcoming webinars, and you can sign up for those by going to our homepage, and very simply on the bottom right-hand corner, there's a calendar of events where you can find a further description about each of these upcoming webinars as well as a very brief registration page. And while the questions are coming in, I'm going to go ahead and leave the contact information as promised up for Triage Cancer as well as for NeedyMeds. And with that, Monica, I'm going to ask you to address some of the questions coming in from our audience. The first one is, I have insurance through my employer, but the policy doesn't cover the doctors I want to see. Am I stuck?
It is an incredibly common question that we get around, do I have to keep my employer health insurance? And the answer is no. We're under no obligation to take the insurance that our employer offers. All of us have the ability to go into the marketplace and shop around. The one caveat I will say to you, though, is if you are offered an employer-sponsored insurance policy, you probably won't be able to access the financial assistance options that I talked about if you try to buy in the marketplace. There's some rules around that. So as long as your employer's policy is what they deem to be affordable and adequate, you won't be able to access that financial assistance. That being said, for some individuals, the marketplace policies may still be more affordable, especially if they cover your doctors in network. So again, you kind of have to do the math and see what's most appropriate for your situation and your needs.
Thank you so much, Monica. Another question coming in. I'm concerned that there aren't very many options in my state's health insurance marketplace. What can I do?
This is an unfortunate reality for a lot of individuals. There have been many things that have occurred in the last 18 months that have threatened the marketplaces. We saw some counties where every insurance company pulled out of the marketplace just because there was so much uncertainty. However, on a positive note, we're seeing many of those places where individuals engaged in advocacy opportunities and really got together and lobbied insurance companies. And one example that was just in the news was in Virginia, where a bunch of just consumers got together and started really lobbying the state and lobbying the insurance companies, and a second insurer came back into the marketplace and is offering policies at really affordable rates. So it just goes to show you that we really do have quite a bit of power as consumers and as voters. As I'm sure you're all aware of, an election is coming up in the next couple of months, and the results of that election could do a lot to change the landscape of what the health insurance marketplaces look like in everybody's state. So if this is something that is important to you, I strongly recommend that you talk with your elected officials and find out where the different candidates sit on some of these policies, because I think it really will shape the marketplace for years to come.
Again, thank you for that thorough response, Monica. And just a reminder to our audience, I am so pleased to see that we have so many questions coming in, because it's just really a testament to how engaging Monica's presentation is. A reminder to everybody that we unfortunately don't have the time to address everybody's specific question, but we will follow up with you via email by tomorrow. But of course, don't hesitate to reach out to either NeedyMeds or Triage Cancer at the contact information you're looking at on your screen. I'm going to wrap up with one other comment or question from an audience member. Really, a number of people in the beginning of the webinar, Monica, you talked about a free Medicare talk specifically for next month. I have a bunch of people that have written in asking details about getting access to that talk, as well as if you could say again out loud for our audience where they can find all of those animated videos.
Yes, so triagecancer.org, which is triagecancer.org. On the events tab, if you scroll down, you'll see webinars. You can just register for any of the webinars that we have upcoming. The Medicare one is going to be on September 12th. We'd love to have you on live so that you can ask questions, but if you can't make it live, we do also record and archive all of our webinars, so please feel free to take a look at that. And then at the same website, triagecancer.org, if you go over to the resources tab, you'll see a drop down for animated videos, and that's where you can access the videos in English and Spanish.
And I'm so pleased to see we have a number of people asking about your webinars and the animated videos, because they are really, I can't say enough good things about them. So with that, we're going to go ahead and wrap up today's presentation. Of course, as I said, the people that we didn't get a chance to answer your question, you will be hearing from us. Thank you so much to our audience for taking the time to join today's webinar. A reminder that today's webinar was recorded and will be converted into a video and posted on the NeedyMeds YouTube channel. And again, you can find that at NeedyMeds.org. The top right hand of our homepage has a bunch of social media icons. You'll see a red one for the YouTube channel. I encourage you to check that out looking for this recorded webinar, but also it is populated with a number of special topic webinars that you may find valuable as well. Thanks again for your time, and thank you to Monica for taking time out of her day to share her expertise and the resources Triage Cancer has with the NeedyMeds audience. Thanks, everybody, and we hope you stay in touch. Take care.